Hello friends, today we will learn about neonatal sepsis. So what is neonatal sepsis actually? It is any systemic bacterial infection affecting the neonates. That's why it is called neonatal sepsis. Systemic infection affecting the neonates, that is neonatal sepsis. Now, which organisms are most commonly causing neonatal sepsis? Most common organism. Here in India, the most common organism is Acinetobacter, followed by Klebsiella. Okay, and worldwide, most common cause of neonatal sepsis is group B streptococci. Okay, so in India, most common organism is Acinetobacter, and worldwide, most common cause is group B streptococci. Let's proceed further. Now let's classify neonatal sepsis. We can divide neonatal sepsis into two. Okay, there are two subtypes. Number one, early onset sepsis, and number two, late onset sepsis. So there are two types, early onset sepsis and late onset sepsis. Now we will see each of them. So what is early onset sepsis? Early onset sepsis usually occur within 72 hours of birth, and late onset sepsis occurs after 72 hours of birth. Okay, now what is the source of infection in early onset sepsis? Source. In case of early onset sepsis, the source is maternal genital tract, and here the source is hospital or community acquired. Okay, now risk factors. What are the risk factors for early onset sepsis? The risk factors are: number one, chorioamnionitis; number two, foul smelling liquor; okay, number three, premature rupture of membrane; number four, prolonged labor; okay, and number five, multiple pervaginal examination; number six, low birth weight baby; and number seven, premature babies. They are prone to neonatal sepsis, early neonatal sepsis. So what are the risk factors for early neonatal sepsis? Chorioamnionitis, foul smelling liquor, premature rupture of membrane, prolonged labor, multiple PV examination, low birth weight, and prematurity. These are the risk factors for early onset sepsis. Now some risk factors for late onset sepsis. Number one cause is unclean hands. Unclean hands are most common cause of late onset sepsis. And then second cause is lack of breastfeeding. As we know, breast milk provide good amount of immunity to the newborn, so lack of breastfeeding predisposes to neonatal sepsis. Again, low birth weight and prematurity are the risk factor for late onset neonatal sepsis also. And one more thing, any superficial infection can proceed to neonatal sepsis. Okay, so we discussed the risk factors for both early onset and late onset neonatal sepsis. Now, what is the most effective method to prevent neonatal sepsis? The most effective method to prevent neonatal sepsis is what? Any guesses? Yes, it is hand washing. Proper hand washing. Okay, so the most effective method that can prevent neonatal sepsis is hand washing. Now let's discuss some clinical features. Clinical features. What are the clinical features of neonatal sepsis? The clinical features are, first of all, they are non-specific. A newborn can present with anything. Okay, so any sick newborn, we have to suspect sepsis. Okay, and now some clinical features, what they can present. Number 1, poor feeding, refusal to suck. Okay, so the first clinical feature which we can get is poor feeding or refusal to suck. Number 2, hypothermia. A very important point. Hypothermia. Why important? Because we all know in adults sepsis manifests as fever. That means hyperthermia, not hypothermia. But in children, as we can see, in most cases they present with hypothermia. Okay. In number 3, there may be poor cry, lethargy, and if respiratory system involved, then we can get what? Dyspnea, tachypnea, respiratory distress, etc. And if the CNS is involved, we can get irritability or even seizure. Okay, so first of all, the clinical features of neonatal sepsis is very non-specific, but we can get poor feeding, refusal to suck, lethargy, dyspnea, seizure, etc. Okay, and hypothermia is very important to remember. Neonatal sepsis is characterized by hypothermia, not hypothermia. Let's proceed further to diagnosis. Now, diagnosis. The gold standard for diagnosis neonatal sepsis is blood culture. Okay, the gold standard is blood culture. But as it is very time consuming, we have to start treatment even before the report arrives, the culture report arrives. So we have to perform screening tests for neonatal sepsis, which is called sepsis screening. Very important, sepsis screening. There are 5 parameters. If any 2 out of 5 satisfies, then we can start treatment for neonatal sepsis. Okay, so what are those criteria? Number 1, total leukocyte count. Number 2, absolute neutrophil count. Number 3, immature by total neutrophil ratio. Number 4, micro ESR, and number 5, CRP, C-reactive protein. So among these 5, if any 2 is positive, then sepsis screen is positive. So what are the cutoff values for a positive result? For TLC, it should be less than 5000 per mm3. For absolute neutrophil count, it should be less than 1800 per mm3. IT ratio should be more than 0.2 or 20%. Micro ESR should be more than 15 millimeter, and CRP should be more than 1 milligram per DL. So if any 2 among these 5 satisfied, then we can start treatment for neonatal sepsis. One thing to add, there is a new marker for neonatal sepsis. New marker. What is that? It is procalcitonin. It is a new marker for neonatal sepsis. Now let's proceed towards management. If the sepsis screen is positive, then we have to start treatment. We can't wait for the blood culture report to be arrived. Okay, then we will be too late. So we have to start with broad spectrum antibiotic, as we do not know the causative organism. So we have to start with broad spectrum antibiotic or empirical antibiotics. That means we can start with penicillin plus aminoglycosides. Okay, so we have to start with broad spectrum empirical antibiotics. And if we suspect meningitis, then we have to add cefotaxime. If we suspect meningitis, then we have to add cefotaxime, because it is a third gen cephalosporin, has good CNS penetration. Okay, and another thing to tell that this antibiotic should be given by IV routes. There is no role for any oral drug. These antibiotics should be given IV. Now the durations. How long we have to continue the antibiotic therapy? There are 3 scenarios. Number 1, if we have started treatment and only the sepsis screen is positive, then we have to provide those antibiotics for 1 week. If culture is positive, then we have to continue the treatment for 2 weeks. And if meningitis present, that means CSF analysis confirms meningitis, then we have to continue the same protocol for 3 weeks. Okay, so this was all about neonatal sepsis. Now a quick recapitulation. What is neonatal sepsis? It is any systemic bacterial infection affecting the neonates, that is neonatal sepsis. Now the most common organism causing neonatal sepsis. In India, here the most common organism causing neonatal sepsis is Acinetobacter, followed by Klebsiella, and worldwide it is group B Streptococci. Now we can further divide neonatal sepsis into 2 types: early neonatal sepsis and late neonatal sepsis. Early means it is within 72 hours of birth, and late means it is after 72 hours of birth. So what can be the sources of the infection? In case of early onset sepsis, it most commonly acquired from the maternal genital tract. Okay, and in late onset sepsis, the source is hospital or community acquired. The risk factor for each of those: for early onset neonatal sepsis, the risk factor is chorioamnionitis, foul smelling liquor, PROM, prolonged labor, multiple PV examination, and low birth weight and prematurity. And for hospital acquired, it is the most important cause is unclean hands. Next, lack of breastfeeding, low birth weight, prematurity, and even any superficial infection can proceed to neonatal sepsis. And what is the most effective method for prevent neonatal sepsis? It is hand washing with 2 minutes and following all 6 steps of hand washing. Okay, now clinical features are very non-specific, but we have listed some that are poor feeding, refusal to suck, hypothermia, not hypothermia, poor cry, lethargy, respiratory system. If respiratory system involved, then we can get dyspnea, tachypnea, respiratory distress, and if CNS involved, we will get irritability, even seizure can be found. For diagnosis, the gold standard for diagnosis is blood culture, but it is very time consuming. So we have to start with sepsis screening. There are 5 parameters to check. What are those? Total leukocyte count, absolute neutrophil count, immature total neutrophil ratio, micro-ESR, and CRP. If any 2 of these 5 is positive, then the sepsis screen is positive. Now there is a new marker available for sepsis screening, that is procalcitonin. Now the management. What is the management? We have to start with empirical antibiotic or broad spectrum antibiotic, as we cannot wait for the blood culture report to come. We have to start early. That's why we may start with penicillin plus aminoglycoside, and if we suspect meningitis, then we have to add cefotaxime. Why cefotaxime? It is a 3rd generation cephalosporin. It has good CNS penetration, and the route should be always IV. Now the duration of treatment. If only If our basis of the treatment is only the sepsis screen is positive, then 1 week is enough. If the culture report comes positive, then we have to continue for 2 weeks. And if meningitis is present, that means CSF analysis shows meningitis, then we have to continue for 3 weeks. And already we know, if we suspect meningitis or meningitis is present, we have to add cefotaxime, the 3rd generation cephalosporin. So this is all about neonatal sepsis. Thank you.